So this brings us to the last panel of the conference, and wow, it has gone fast. Brenda and I were discussing how, months and months of planning go by in a few quick hours, and then you have that, after crash of what do we do now? But we'll talk about next steps a little later. Our last panel is a little bit different again. We're going to be learning from what's happening in other jurisdictions and potential policy innovations. So we want to look at what is working well in other jurisdictions, what policy recommendations we can learn from other jurisdictions, both inside and outside of Canada, that could contribute to a more inclusive and equitable future for the health and well-being of all disabled children living in Canada. This panel is again organized slightly differently. Like our first panel yesterday, we've divided this into 3 different segments. So it will begin with a conversation between our moderator, Brenda Lenihan, and Anouk Lanouette Turgeon. Okay, good, I got the thumbs up. And I also just wanted to say, Anouk, without crying, thank you for that beautiful tribute to your daughter. That you shared with us all. Anouk is a mother to Eli, who lives with Down syndrome, and Lassa, who died from a very rare genetic progressive disease in 2019 at the age of 5. Her children inspired her to advocacy, which has led to financial support for families with severely disabled children in the creation of the Supplement for Handicapped Children Requiring Exceptional Care in Quebec in 2016. And, to throw another hat into the ring, her first novel was published in 2021. Brenda is, again, a mom to a young son with health complexities and the co-founder of BC Complex Kids Society. And she is appointed to the National Advisory Council on Early Learning and Childcare and the Minister's Advisory Council for Children and Youth with Support Needs in BC. And I look forward to a riveting, and I will probably start crying again, conversation between the two of you.
Thank you, Amanda, and thank you, Anouk, for being here. Anouk and I think we met at a very early Disability Without Poverty event few years ago now anyway. And I'm really happy to be here chatting with you today. Thank you for joining us. And we wanted to learn a little bit about your family, your experience, and how it came to be that you advocated with other parents for this benefit that was came to fruition, and we just want to learn a bit more about what that benefit looks like after. But first, maybe just starting with your experience and the advocacy piece.
Yes.
Thanks, Anouk.
Well, thanks for having me. And I prepared a couple of notes to tell you a little bit more about how it started, how it happened, and how it was possible to create this supplement for exceptional children that we have here in Quebec. So, as Amanda said, I had 2 children, and back in 2014, another mother, Marilyn Picard, she was actually the ignition point of this small group of mothers, Parents Jusqu'au Bout, who came together. She published a post back then where she had just resuscitated her daughter on the lounge couch after a severe seizure episode. And so she described in this post the complex care her daughter required every day. And so it felt a lot like my life. And so we eventually, this post was shared like more or less 10,000 times. It really became viral. And so we connected, a couple of us connected with Marilyn, and Parents Jusqu'au Bout was born. So Parents Jusqu'au Bout could be translated like maybe parents until the end, but it's like an approximate translation. Anyway, so we came together, a very, well, small group of 4 very motivated mothers. We had no experience whatsoever with advocacy of any sort. We had never met a politician before in person, no lobbying experience, no media skills, no nothing, just 4 random mothers. Very fiercely convinced that families like ours deserved better financial support. So what was our main argument? Well, quite simple. Natural families with a disabled child used to get about, for financial support, used to get about altogether $300 and something a month if we combine provincial and federal supplements or benefits, and versus a foster family, you know, who would accept to take care, to be the caregiver of a severely disabled child like the ones we have, would get approximately $40,000 a year. So these numbers struck people's minds. You know, $4,000 a year for a family, for the natural family, versus $40,000 a year for a foster family. And a lot of families did actually have to give away their children in foster families, and they were writing to us, and it was absolutely heart-wrenching to read all these stories. And so we started telling our stories. We started, you know, and some journalists, plural, started paying attention. And we were in every radio show, TV show that we could be on, but we also tried to meet our local MPs. Opposition parties in Quebec started also to pay attention and supporting us and challenging the government at the Quebec National Assembly. More and more parents followed our Facebook page, up to 15,000 followers at the time, and we encouraged every parent of a disabled child to speak up and call on their local newspaper, radio stations, whatever. So there were several parents who talked to the media, and there was also the political scene that we tried to talk to. Anyway, and so there was sort of a build-up, gradually, sort of a momentum at some point, because at the beginning, we didn't have much hope. You know, we were told by one of our local MPs that we would never get anything, and that it was, you know, useless and hopeless to try to get anything more than what we already had. The health minister ignored us all he could. But then a couple of months later, he couldn't ignore us anymore. So they created an interdepartmental committee, and well, to make us feel important, I guess, or to make us shut up, I don't know. But we said thank you, but that won't do it. That's not enough, and things have to move on faster. You know, parents, you know, families are torn apart because parents have to give away their children to foster care. It doesn't make any sense. You know, we insisted that our houses are on fire. We can't wait for some committee to analyze and, you know, agonize on our situations. So, three major helpers. First, Maître Ménard, who's a lawyer in Quebec, like #1 lawyer in health issues. He's sometimes he takes pro bono cases when he's sure it will, you know, he will win. And he had such a terrific success rate that the government is scared of him. So we weren't at the point where he accepted to take the case. He was only studying the, you know, possibility of it. And but in some interview, we just dropped that we were, in contact with his cabinet. And so we'll never know if that has anything to do with the fact that we finally got to meet the health minister. But anyway, just, mentioning, thanks to Maître Ménard. Also, we met Mathieu Santerre, who's a PR expert and who used to be the president of the Lobbyists Association in Quebec. So he offered his services pro bono, totally. And we really were, we were already good, but with him, we became like all of a sudden experts in PR. So we, he actually helped us secure a meeting with the health minister and prepare for it. So thanks to Mathieu also. So with all this media attention and political attention also, we ended up being invited at the most listened to talk show in Quebec, TV, Tout le monde en parle. So, and they had invited the health minister on the set. So in front of 2 million people listening to him live, he just couldn't refuse to meet with us. And he did. So that's basically what happened. So exactly 3 months after we were on that TV set, the new supplement was created, which is around $1,000 a month, plus the basic supplement. It's around $1,300 a month for eligible families. So it did happen after only 16 months of fierce fight. I call it a near miracle because I didn't believe it would happen, really, but it did. And one last word, actually, I want to stress that the key to our success, according to my non-scientific self, is that we had an organic way of working together. It was only the 4 of us, but we had no organizational chart. We had no structured plan, no tasks, no lists of tasks. We acted, very instinctively, actually, very naturally. Most importantly, we had no ego in this, it wasn't about me or her being in the TV or whatever. Mm-hmm. We had one message, a clear focus, unwavering willpower and sense of purpose. This had to happen. So it did, and it was life-changing for a lot of families. This being said, there's no, it's not perfect. The eligibility criteria are absolutely insane. I mean, I got, and there are 2 tiers, I got tier 1 for my daughter. I got tier 2 for my son, but I can't explain exactly how it happened because it's too complicated. And it's a 13 pages form to fill out, so unfortunately it's not like easy to get, but at least it's out there and it's better than what we had or didn't have before.
Absolutely. Amazing advocacy work too. It's amazing that within 3 months of that conversation it was created. That's incredible. I know it took longer than that, the advocacy, but again, it happened fast, and it sounds like a lot of it had to do with getting society to see families, and that is definitely it can be tough. I mean, in BC, we're trying to push right now on advocacy around home care supports, and the interest isn't always there. So it's great also that you found that key and that door in to the consciousness of society. It's
it was several things happening at the same time, and part of that is absolutely not we had no control over, but
circumstances. Beautiful. So that support now, so for a lot of families, is close to $1,000 a month, and of those who are eligible, but like you said, there's still some barriers. And I wanted to also note that as you mentioned before to me, that there's still a lot of barriers in the other supports in Quebec. So
Yes.
it's not that this was the final gap to be filled either. There's a lot of other systemic issues that, it's not the whole package. It doesn't solve everything for everybody, but an incredible piece that supports many families, I'm sure, in a good way.
Mhm. Yeah. Of course, the system here is not perfect at all. Don't move to Quebec. Just.
Yeah, no.
I mean,
But the thing that we need to learn here is that there's good things happening in other jurisdictions, and if we can pull those good things across the country for other families, we might see some change that is positive for families.
Yeah.
Thank you so much, Anouk, and thank you also for sharing your beautiful work. Your reading from your book and your beautiful video with your daughter is incredible, and we really appreciate you sharing that with us, and for being here, and for spreading the word in Quebec, and just being amazing. We really appreciate you.
Well, thanks for having me, really. Well, let's hope for some revolution.
Yeah, well, we might have to create that revolution. Unfortunately, that was the other piece we were going to talk about, but we don't have too much more time, but just that burden of advocacy on families, the fact that you needed to take that time, the fact that I and so many other parents take so much of our time that we don't have because we see the injustice. And we really need allies. We need healthcare professionals. We need others to do this work with us and for us. And we need things to move in a better way towards change. It can't be all on our already burdened shoulders.
Yeah, absolutely.
Amazing. Thank you, Anouk. We're going to say goodbye and move on to the next discussion.
Yeah, thank you to Anouk and to you, Brenda. And I think I'm sensing, I'm hoping a cross-country gathering of mothers or parents to make this movement really not just provincially, but what can we do broader that speaks to our own provinces. Next, we have Hubert van Niekerk, who is Vice Chair for Every Canadian Counts, which advocates for a publicly funded national disability insurance plan for all persons with long-term and chronic disabilities. For 19 years, he served as a member at large and has been president and past president of the Ontario Association for Developmental Education. Joining Hubert is Catherine MacGillivray. Catherine is a physiotherapist who primarily works in the pediatric disability area of care since graduating from the University of Queensland in 2016. She worked in Australia when the National Disability Insurance Scheme, the NDIS, was rolled out and saw firsthand the positive impacts this program had on families. She's a volunteer with Every Canadian Counts, and Brenda will likely pop in at the end of the presentation to ask a question or two of you both. Over to you.
Hello, am I working? Thank you. So yes, my name is Hubert van Niekerk. I am the Vice Chair of Every Canadian Counts, ECC. It's a nonprofit, volunteer-led organization consisting of disabled and non-disabled persons. Among other things, I am a retired special education specialist teacher where I taught students with pretty much all disabilities, including medically fragile, where students would pass on a regular basis. ECC is advocating for a publicly funded national disability insurance plan for all people living with long-term and chronic disabilities from cradle to grave. I am joined by Catherine MacGillivray, who you'll hear later, from a more practical point of view. I will be using the term PWD to describe persons with disabilities, disabled persons, and hope not to offend anyone as both terms are used. We believe the NDIP, which is our plan, is the next big challenge to improve lives in the disability community. We at ECC is not competing for that little piece of pie that is being fought over and divided. We want to see all disability associations, parent groups, caregiver groups, and disabled unite with one voice to support this plan. Such a plan would be needs-based, not based on diagnosis. I've listened to all the fantastic speakers at this conference yesterday and today, and I see individual struggles in all areas, especially when I heard about, or did know, but again, Jordan's principle, the northern communities, Khadija, Alana, Jennifer, Abi. I'm so touched and humbled. It doesn't have to be this way. The financial burden should not be yours. So our purpose today is for you to start thinking and acting, to take the initial first step to join us in the creation of a publicly funded national disability insurance program and address the needs of the most marginalized group in Canada. PWD support in the last item on almost all agendas. Regardless of province or territory, support services for PWD are underfunded and inadequate to task, as evident in long waiting lists. They are inconsistent in application of benefits, inflexibility, and delivery, and are nightmarish to navigate. There are a lack of standards and inadequate data. Australia addressed the problem comprehensively through the creation of the National Disability Insurance Scheme. The impact of this program has been profound and deep, increasing the GDP by 2%, generating employment for PWDs, allowing mainly women to re-enter the workforce or education by paying caregivers, or go fishing, or just be a parent, as I've heard today. So consider, the issue of inadequate support is not widely recognized by the public at large. They think people with disabilities are just fine. The current system is simply not suitable to the task. A new funding model is in order that meets demand and is sustainable and economically beneficial. The plan would be portable across Canada, no matter where you live. Such a model exists in Australia with the NDIS, and we want it here, only better. We can learn from the mistakes. So not long ago, every Canadian Council met with Minister Qualtrough to discuss the way forward in the desire to provide better disability support for Canadians. It was emphasized that if we are to go forward, there would need to be research to get to where we needed to go, as much as it would be efficient to just copy and paste Australia's model. But we can certainly learn from their mistakes and successes. We need to research into the feasibility, viability, and desirability of this plan. It is new. There is no design to the plan, and there is no cost-benefit analysis in place for such a plan in Canada to date. There is no understanding of how federal, provincial, territorial, private insurance interactions would occur under such a plan. These questions need to be answered, so research is the initial first step. This plan could be paid for through simple wage deductions similar to EI or CPP. It would change the discourse surrounding disabilities because the plan will not be seen as welfare, but investment in people for the future. The NDIP was put forward for consideration from 5 Liberal EDA associations just recently. The closure of institutions was one of the greatest social policy changes of the 20th century, but the social and economic segregation that followed was atrocious. Closing doors are one thing. Making fundamental changes to our policies and programs and changing the way we think is another. People with disabilities want to bring about transformation in their lives. Younger disabled people don't want to live in long-term care homes like Jonathan Marchand of Quebec. He's our chairman, who managed to achieve a pilot project to move into his own apartment and manage his own affairs after he caged himself in front of the legislature. Disabled people want their human rights recognized and realized. They want the things that everyone else in the community takes for granted. Disabled people desire change, and they want others in the community to share their vision. Disability voices have become louder, and they now demand a revolution, I would suggest, for their voices to be heard. Australia has provided the model for a better system. It was unanimously supported across all parties. It was supported by 85% of the population in a referendum, and we're 93% of those affected rating the program as very good in a recent poll. So please join us to make this happen. Catherine.
Hi, folks. My name's Catherine. I'll talk as briefly as I can on this, although I'm sure I could probably fill up 3 hours of your time with the amount of experiences I have. But yeah, as was mentioned, I graduated from a university in Australia for physiotherapy back in 2016. And this is when a lot of those programs were being rolled out with the NDIS across the country. And it was just absolutely incredible to be there and see the impact on families. I have also worked in New Zealand, the UK, and Canada. So I've seen kind of quite a broad spectrum of different jurisdictions. And I've been a pediatric physio that whole time. So I've seen, how disabled kids are being supported differently in different areas. So with that, in Australia, it was so cool because like before I started working there, these families had not had physio or home modifications or easy access to a lot of these services. And I started working at a rural clinic in Western Australia. One story I feel just illustrates this so well. This family lived on a farm and they had a little boy with very complex needs, a rare genetic condition. And they were at that point where they kind of had to consider leaving their farm business because they're 3 hours from Perth and they couldn't access anything they need. And the NDIS rolled out, and all of a sudden, this little guy could get physio at home, working in the little chicken coop on the farm. They had home modifications come in. They had orthotists come, like, drive out to do measurements for splints and things to get made. And it saved this family having to travel 3 hours into Perth to like pay money to access all these things when there is already such a big financial burden. And it really turned their life around. It turned their farm around. And this little boy, his quality of life just shot up exponentially, and he could do more things around the farm. It was just like a really incredible thing to watch that, change happen as they got access to all these services for the first time. It's also interesting in Australia, they're funding intensive physiotherapy care. So the kids can go for like longer blocks of daily physio at different points in the year that work for the family, if that's something that they want to do. And it's the only time in my professional experience I've seen kids with cerebral palsy who are a bit older kids move from one GMFCS level to another, which I've just not seen anywhere else in the world. And it's just because they get such amazing amounts of like intensive care that they need to work on to achieve certain goals that are meaningful for them. So I guess from that practical point of view, it was just amazing, like working in that kind of a system. And I'd like to compare that to the UK, where it's also totally publicly funded. On the surface level, they get free physio, free OT, free home modifications, and all of that. But instead of that money being put directly into the family's hands to choose where they want to go and access, it's all delivered publicly as well. So that comes with a lot of the inefficiencies that I think we see across Canada, whereas the money gets kind of into this welfare system and then it's allocated to a hospital, and then you're on these wait lists forever and ever. Or from my perspective as a physio, I might see like 16 kids a day and they might not get another physio visit for 3 or 4 months if they're lucky. So I think where Australia did it really well is putting the money into the hands of families. It's all publicly funded, but it just gives the families that power to find what works for them, because everyone's different. Someone might love one OT and then another family might find a different one that suits their child's needs better. And I think we, like, families deserve to have that option, and they should be able to make those choices and not just have, a hospital say, this is the one in your area, so you have to deal with that. So I think that's where Australia did a lot of things right. Obviously, no system's perfect. So we can definitely learn from the mistakes that they've kind of, been working on over the last few years. But I just I feel so passionately that, you know, kids and people across Canada, doesn't matter if you're, you know, on Vancouver Island or in the middle of Toronto, like you should be able to access the services you and your family need. And it shouldn't be so fragmented, depending on where you're from. So yeah, I think that's kind of just to, I guess, go into it briefly there, my experience working as a therapist in these systems. And hopefully I can take some of the burden off some shoulders here, because I think you're absolutely right. Like we need more allies and more healthcare professionals doing this work too.
Wow, thank you. It's really pretty incredible to hear that firsthand experience of it. And it resonates here in Canada and BC, and from what I've heard in Ontario and other provinces, specifically around that therapy piece. We've had a lot of discussions where we realize when parents are funded, then the people that it creates an economy of, you know, smaller businesses of private physiotherapists, and those therapists are able to choose their caseload so that they can give the appropriate support and care, instead of being in you know, we have a publicly funded system, but it's underfunded, and therapists aren't paid as well, so they're not attracted to those jobs, and there's just huge burdens and wait lists. It's incredible, and it doesn't work well. Like a system, as we talked about before, needs to work for the therapists and for the families, and be an exchange of buying services, and you have a service to provide. It's really nice to hear how that can work, and how that, because it is a really foundational piece, as we heard earlier, about, with regards to health outcomes, having that therapy support.
Yeah, absolutely.
Yeah, it's interesting too, also to hear about I'd like to hear more about the New Zealand system at some point with you, but we do have a couple more minutes. And I just wanted to maybe ask you a little bit, because it's important to recognize what, I mean, all systems aren't perfect, but I have heard that there were some challenges with the system, and that they're actually working through some adaptations to the program to improve it. And yeah, I'm curious to hear a bit more about those pieces as well.
Yeah, I'm sure Hubert, you can probably chat to this too, but there was some issues, I think, because there's, if I understand all of this correctly, there's basically no caps on what therapists or services could charge families for things. So all of a sudden families have all this, you know, funding to access care. And a lot of businesses and corporations really did take advantage of that. Hubert, I'm not sure if you have any more details on the specifics.
Yeah, just that they are doing a review of the plan right now, just to weed out fraud. There was some, you know, dirty business going on as well, as far as total fraud. Call it something else, wasn't the mafia, but it was along those lines. So they are cleaning it up. You know, I keep saying, when people say, well, yeah, but this is happening and that's happening, I say, yeah, I wish we had that problem here in Canada, that we could actually weed out what wasn't supposed to be there. So, you know what, I'll just, you know, put one quote that, so what we're trying to do sort of next is that, you know, we're looking for the Canadian government to consult with provinces and territories to engage in a public education information sharing campaign that is nonpartisan, inclusive, transparent, and effective. So we sort of have to, like Brenda and I and the other volunteers we have, are not going to be able to bring this to the finish line. You know, in Australia, we're happy to consult along the way. But I think in Australia, what they managed to do was they got 3 big groups together. So whether that might be, you know, Inclusion Canada or whoever, you know, the government sort of forced them to work together. And that's how it sort of started. There was Bill Shorten who was charged with putting this into play. So they felt it was needed. They felt that the time was right. And he basically said, we have to do this. We're doing this. And Bill Shorten at the time didn't really know much about special needs or disabilities. But he went across the country, and after doing that, he says, absolutely, we have to do this. So the government forced it, that it had to be done. So we kind of have to get it to that point. Everybody has different political affiliations, but I was at the Liberal Convention last weekend, and that's where we rub the elbows. That's where we talk to the policymakers. We need that in all the provincial governments or all the federal government parties, so that we can push them all to go for the same thing. It truly is, when you heard Catherine speaking, that was a practical example of exactly how this is supposed to work in the end. And it will take everybody getting together to push for something. So if you're talking to a member of parliament, our wish would be that, I heard that the Australian model is really working. We want it here. They get this, they get this, they get this, they get this, and we don't get anything. So the idea is that it comes off your paycheck, everybody's paycheck, goes into a separate held trust fund. When you need it, whether it's at birth or along the way, the funds are there to support your needs. And it really is almost as simple as that. The money is there because it comes off your paycheck, and that worked out, I think, to about $400 a year. So just, to answer that question.
Yeah, and it sounds like it's a holistic program that supports everything from medical equipment, medical supplies, therapy, a care benefit. I understand that's maybe not that easy to get, but that is there. And is there any income support with that program as well? The care benefit?
Yeah, the caregivers.
Yeah.
Yeah.
Yeah, as far as I understand, if you decide to use that program to fund yourself to care for your child, you basically get that as your income. Is that right, Hubert? I
Yes.
think that, yeah.
Yeah. And it includes mental health as well. It was sort of last getting in. It was all sort of physical disabilities, but they did include the mental health issues. And I did hear it from a couple that's in Australia that say it probably should be a little bit more, but it's certainly a lot better than what they were because they weren't getting anything. So now it also includes mental health.
Wonderful. And are there opportunities there to also have, so for families who maybe don't want to manage or can't manage the supports themselves, like the organizing the therapies or respite or those kind of things, is there support as well, like host agencies that you can use for that? Yeah,
you can choose to have it family run or through an agency, and then the agency can deal with all of that for you.
Super important to have those options.
Yeah,
it makes the agencies earn their money, I suppose. I know that there has been some pushback because things will change for agencies. Many agencies get very comfortable, maybe, how they're doing things, and they get the money and then they disperse it. So there will be accountability, and that will be a hurdle to overcome for a lot of agencies. But the competition will be there, and
absolutely. Well, thank you so much. We talked before we had this discussion, we talked about the idea that it might be worth planning a webinar of sorts for maybe an hour or maybe longer to dive deeper into this and learn more. I'm not sure if we landed on a date, possibly, but I did want to encourage anyone here, and we can promote it outside, but encourage you to I think the link is in the chat for Every Canadian Counts, which is the organization in Canada that Hubert and Catherine are part of, and join their newsletter. And we're looking at maybe in June putting together a webinar to look at this a little deeper and learn more. I'm keen to learn more, and I think it sounds like a model worth looking at, definitely, especially since somebody else is doing the hard work of the stumbling blocks and working through those issues for us.
Yeah, if we can get the government, to really pick this up, and the only way we can do that is to pressure the members of parliament. And so each of us need to do that and say there's got to be a better system.
Amazing. Thank you both for the work you're doing and for being here today. And yeah, I'll look forward to more discussion and a webinar and look at what we can do to work together.
Yeah, thanks for having us.
Yeah, for sure. Thanks for the opportunity. I'm, all the presenters and you, Brenda, Amanda, unbelievable. Thank you from the bottom, of our hearts.
Oh, thank you, Hubert.